Welcome back to Inside Update. Today is June 14th, and every other week on this show, we catch up about headlines across Connecticut, specifically from our nonprofit newsroom, InsideInvestigator.org, where we focus on rooting out corruption in Connecticut through investigative journalism. Today, I am joined by Mark Fitch, senior investigative reporter, and Catherine Revelo, investigative reporter on the Inside Investigator team. And we are going to start off asking Catherine about her newest investigation. It's called Stonewalled. Spoiler alert, it's about transparency. Second of all, we're going to talk to Mark about an examination he did of a Waterbury doctor who says that the state's weight loss program, which we've talked about previously on this show, is costing him patients. I think some stuff is going to California. We're going to learn a little bit more about that. So let's start with Catherine, though. This is a great investigation. I'm not going to spoil anything. I'm going to let you do the whole introduction here and bring us into this world of what you experienced and also what the subjects of this investigation experienced.
Yeah, absolutely. So I think it's probably no secret at this point that I'm pretty passionate about FOIA. I write about FOIA a lot. And this story came about because one of the Lorena Venegas, one of the people who's featured in this story, had previously worked with Trisha Ennis, another member of our team, on another story. I had come to her and basically said, "Hey, I'm having a lot of trouble getting my FOI requests fulfilled with Tweed New Haven Airport and with the town of East Haven, Connecticut." And she connected us to another member or another resident of East Haven who was having the same issue, right? You know, this is kind of a difficult line to deal with, right? Because we know Connecticut FOIA is not fast. We all know that. We all deal with it. We're all frustrated by it. Um, and, there's nothing in Connecticut's law that requires agencies to be fast. So, we kind of all expect to wait for information, but how long is too long to wait, especially when you know that public officials already don't want to answer your questions. And so that's kind of what we went through with this was we reviewed a bunch of FOIA requests that they had submitted, largely to East Haven, that they hadn't gotten responses on, and not just that documents weren't turned over, but that after the request was initially filed and acknowledged, requests to follow up like, "Hey, when can I expect to see this information?" just went completely unanswered. And in some cases, these requests are over a year old. So, to kind of verify what was going on here, I submitted a request to East Haven just to see how many, pending and open requests they had received, how many had been fulfilled. And we got no response. We got, the initial response of, "Yes, we're acknowledging that we've received a request," and then nothing after that. And potentially what's an issue here, which we've seen in towns like Bridgeport that have had numerous issues with FOIA and have been kind of slapped on the wrist by the FOIC, is they tend to route FOIA requests through one person in the town. In the case of East Haven, it's the town attorney who is responsible for handling every single request that comes into the town. So potentially, this is the issue here, and to kind of test this, we also sent requests to the surrounding towns and got, a varied number of responses. But, in some cases, we got information back right away. And in some cases, we got information back that we didn't even ask for. We got responses from public records officials that said, "Hey, you asked about this. Do you want this information too? We're happy to provide it because we believe in transparency."
That's pretty cool. I actually really like that we were able to tell a positive story there as well. Like bring
Yes.
uplift. Hey, if you're, let's talk about the situations where people are doing stuff right. It really draws a very clear distinction.
Right, yeah. There are good public records information out there. They're sometimes very hard to find, but there's a big difference between, obviously people run into issues with FOIA, and sometimes people either don't formulate requests the right way or are requesting information that either isn't available or isn't subject to FOIA. A good public records officer is going to work with you on that and is going to be communicative. And then, you have people who just don't respond to questions and just kind of let things languish for potentially months and sometimes years on end.
There seems to be some confusion too about like what makes a legitimate FOIA request. I know that's something that we've heard several times, like, hey, this is a request for information, not documents. I don't know if you have any just quick insight to help people who submit FOIA requests, make sure they do it in a way that will get a response. Do you have any thoughts there?
Yeah, I think one of the biggest things we saw with this investigation was, a FOIA request is supposed to be a specific request for information. It's not a question about, hey, can you clarify this or that? So, when you are filing FOIA, be specific, I think is one of the biggest things that I think that we live by and that people who successfully file requests is make sure you're saying, hey, I want this piece of information. I want it from this person. I want it from, this time frame, and just try to be really clear in your communication.
Hey, Catherine, with your look into East Haven and Tweed Airport and the FOI stuff, was there any issue regarding, which part is public and which part is private? And, is this a quasi-public thing or a public-private partnership? Does that get in the way?
Right. So Tweed New Haven is quasi-public, I believe. And, Connor, I know that you got into, we got a little pushback from Tweed New Haven about some of the stuff in our in our piece. And I know, Connor, that you spoke with one of their representatives a little bit about whether or not they were subject to certain things because they are quasi-public. So I don't know if you want to speak a little more to that.
Yeah, I mean, ended up spending upwards of 2 hours on the phone over the course of several days with Tweed, and that was one of the topics that came up because, my question to them was, "What is your obligation for transparency as a quasi-public?" And they said, "A, it's a gray area." They definitely acknowledge that, but they also said that they're very protective of the part of their business that is not. Related to the public. They justified it actually around like a competitive advantage, which I'll be honest, I didn't fully understand. Maybe that's just me being a little biased working in a newsroom where I'm like, well, listen, if it exists, I want to have access to it. So I wasn't entirely compelled by that, but they were definitely aware of that. And what I found interesting, and this was all in an on the record conversation, was that the spokesperson said that through dealing with just examination of our investigation, they're talking to management on the airport side, so the Tweed New Haven side, and also on the private side, the Avport, which I think makes it really difficult to understand the full picture. Because if you're involving some public officials, some private leaders in this, but they're all talking about the same thing, which is relevant to the public, it really gets messy very fast. And that's I'm not saying that anybody's necessarily intentionally hiding anything, but it really does make that line circumstantial. It changes case by case. And unfortunately, it seems like it also is tied to how the argument that the quasi-public wants to make in this particular circumstance to maintain whatever either privacy or competitive advantage that they think is important. Really difficult position for reporters, especially as you guys are trying to seek out the truth.
Yeah, and I think one of the other things that makes it more complicated is if you look at the board of directors for the airport, right? Most of them don't actually represent, Avports or, the other organizations that actually run the airport. A lot of them are appointed by either, New Haven representatives or East Haven representatives, because those are the two towns that the airport is in, or they're appointed by regional government boards. So like trying to figure out who's actually a representative of the airport and who to contact for certain things is really difficult and is not clear. And I think that has contributed to some of the issues with getting public information out of them.
I mean, I also want to give credit where credit is due. So following the release of the investigation, and the first conversation with Tweed, one of the complaints they had was about, reaching the right person for public information. And, they previously did not have any language about who to contact for FOIA requests on their website. And as a result of your work, Catherine, they have now added that to their website with a single email, a single person. They also throw in some language saying like, this is what we think a FOIA request should be, which, I think the FOIC needs to clarify perhaps that gray area a little bit more. But that is a step in the right direction. At least future requesters know where to go. And hopefully that'll make their life easier as well. So they're not getting requests that are to the wrong person, but also requesting things that are outside of the scope of what is requestable.
Yeah, absolutely.
I think this is just kind of an interesting, point when businesses, who are generally used to having privacy start working with the government and they have to have this kind of adjustment period. And I think that isn't just businesses, it extends to business people who, perhaps leave, private, you know, uh, world of privacy, privacy and come into, I don't know, being governor maybe. And suddenly, oh, well, I have to disclose this and that and aren't so thrilled about it. So it's just one of those kind of examples of the lessons that some business people have to learn if they're going to jump into the public arena or the political arena.
Absolutely. Absolutely. I don't think we're at the end of this. Spoiler alert, Catherine, I think that we're probably going to see more transparency content from you. There are there are more investigations. You pointed this out right in the first, I guess, the introduction of the investigation as well. To a certain extent, Connecticut has a unique circumstance that allows for this. The stonewalling, the dragging of feet. In other states, sometimes it's yes, you have to acknowledge within 5 days and then provide all of the information in 30 days. That's vastly different than here, where, yeah, hey, maybe it's, I have one out right now that I'm waiting 9 months on it. I know you guys both have stuff that's stretching 1 year, 2 years. Mark, what's your max? Right, 2 years right now that you're waiting for information. It's problematic, at least concerning from a journalist standpoint. But I think from anyone who's interested in getting transparent information would be on board with examining that further.
Yeah, absolutely. Let me just put a little plug in here. If you've experienced stuff like this, you have stories about, public officials who are not being transparent, who are not answering questions or not responding to FOIA, reach out to us, let us know. We're happy to continue telling these stories.
Absolutely. Absolutely. Yeah, that'll end up on Catherine's desk quite quickly. So
Yes.
that's good. Let's move on to our second story then. Really interesting. Again, I'm not going to try to provide a synopsis here. I'd like Mark to jump in. Waterbury doctor says state weight loss program is costing him patients. What's going on?
Yes. So, I mean, everybody is probably aware of these, very new and popular weight loss drugs like Ozempic and Wegovy. I don't know how they work, but apparently they do, but they're super expensive. The state of Connecticut provides coverage for these weight loss drugs. The state, through the comptroller's office, sees them as preventative medicine, essentially. If you can lower your weight, decrease your risk of diabetes, and God knows how many other health issues that come along with obesity, they see that kind of as a net win for them. And the state is currently spending about $40 million a year on these high-priced weight loss drugs. To get them, though, to actually, be prescribed weight loss treatment, state employees and their family members have to enroll in this program called Flight, which you essentially do over your phone. It's a telehealth program that was created by a company called IntelliHealth. Uh, IntelliHealth is a company that the state's venture capital quasi-public entity invested in 2022, right before they started requiring state employees to use IntelliHealth's program called Flight. And IntelliHealth and Flight are based out of San Francisco, California. So if you're a state employee, you want to go on these weight loss drugs or have weight loss treatment, you have to use Flight. Well, what happens to that state employee's current doctor? Well, they can't prescribe the drugs for you anymore. They can't treat you for weight loss anymore. And one doctor reached out to us from Waterbury. His name is Marcos de Escobar. He runs Corbella Health in Waterbury, and says he sees over 1,000 state employees through his work as a naturopathic doctor, and he focuses on weight loss. It's one of his primary fields that he works in. And he's been losing patients by the hundreds because they can't get their treatment or prescription from him anymore. They're forced to go to Flight. Uh, Obviously, this is costing him money, and he's questioning why Connecticut is essentially exporting physician treatment to California when you've got physicians right here in Connecticut that are doing the work. Why are people being forced to use telehealth when there's a doctor right there? And, according to him, himself and other doctors get chastised for using telehealth too much by the state. So it's an interesting problem. The comptroller's office says that Flight is intended to ensure that Connecticut's taxpayer dollars are being spent wisely. At the same time, they're being spent wisely and being sent out of state rather than supporting physicians here or allowing state employees to continue seeing the doctor of their choice. After the story came out, we have gotten a number of comments on the story from, I assume, state employees who are not happy that they have to use this Flight program and want to continue using their own doctors. So it's something that the comptroller's office is looking into. They say that they're working on a deal with Hartford Healthcare, massive, healthcare company in Connecticut, to enable state employees to actually see people in person. But that doesn't really help a private practice doctor in Waterbury. One of his other criticisms was this: everything the state does is to bolster these massive healthcare systems like Hartford Healthcare, leaving private practice doctors like himself just out of luck. And he doesn't know how much longer he can continue working in this state if everything is kind of going against him.
Medicine is supposed to be personal. In many ways, each person's different, right? So I feel like that is a loss, or it's a real question of getting the best care if you're going to be stuck in systems that aren't serving you. You've written about Ozempic and Ozempic before. It seems like this drug is having a moment culturally as well. I was looking around. Weight loss drugs seem to be helping women get pregnant. There are a whole bunch of different, 30 pounds in 2 months. The headlines are all here. It's a blockbuster obesity drug is another one that I saw. But the cost also seems to be a thing. I also saw that Blue Cross of Michigan is axing coverage for these weight loss drugs. So there are states that are moving away from it. It doesn't seem, though, that if anything, Connecticut's doubling down on wanting to make sure that the state is providing access to this. Am I understanding that correctly?
Yeah, and that's something the comptroller's office also pointed out, is that, hey, other states are restricting use of these drugs. We're, leaning into it, essentially, saying, hey, if you're not obese, you're in better health, and that actually kind of saves us money in the long term. But yeah, these, if you're spending 35 to 40 million per year on these drugs, that's about 10% of the total healthcare spend in Connecticut. So it's some big money. And I think they said they have roughly 4,200, maybe more state employees or members of the state employee plan enrolled in Flight at this moment. So we'll see how that goes, if it goes up or down. They're really hoping that the cost curve flattens out, because it's been growing rapidly. I think back in 2020, they spent like $7 million on these drugs, and that was before they got really huge and all the Hollywood actors started taking them. Now 35 million, 40 million. And of course, the loss of some patients for private practice doctors.
It's true. Once Oprah started using it, that was really game over for popularity. So I'll also throw out, we were talking about if you're someone who has had your local doctor impacted, just your medicine is changing. That's a topic that we would be interested in hearing from people, from how is your local medicine, your provider, your private healthcare, what's changing in your world. Connecticut seems to be going through some sort of ebb and flow, some adjustment period that we would like to be a little bit more informed about. Mark, are there any other topics related to this that you would want to hear from people about, or anything related?
No, I mean, if there's other doctors that say this is happening to them as well, it's interesting because when CVS, which is the state's pharmacy benefit manager, sent out the initial letter to doctors who were already prescribing weight loss treatments for state employees, it was like, if you have already been treating somebody, you can continue treating them. But what they didn't tell them is that you can continue treating them for about a year. And then after that, we're cutting it off and they have to go through flight. So it was another issue. So, when I asked Dr. De Escobar about, I said, well, it says that you can continue seeing your patients and treating your patients if it was prior to July 2023. And he's like, nope. He's like, all my patients are now getting rejected at the pharmacies, saying that they don't have coverage anymore. And when I looked into it and I went to the frequently asked questions page about flight, it said exactly that. It wasn't in the letter, but it was, you can continue receiving your typical treatment, your normal treatment for up to a year. And then after that, you have to be in flight. So whatever employees he's seeing and treating for weight loss, they're all going to have to go through flight. Obviously, that's going to cost him a chunk of change, and who knows who else in the state this is affecting. So if there's other doctors out there that are experiencing this, if there's state employees using the flight program that want to register their thoughts on it, I'd welcome all.
Absolutely. We will read the fine print for you, as Mark just alluded to. That's a very important part of the job to get the full picture. That is awesome. Thank you for looking into that. Catherine, thank you for Stonewalled. We're excited for new investigations coming out. We have a new investigation coming out this Sunday by Brandon Whiting. It's his second, about a cold case, a missing person from 30 years ago, and what the family has gone through since then. Really fantastic read. Excited to share that with everyone. And I guess we will look to wrap up, unless Mark and Catherine, you have other topics to discuss. All good. All right. Awesome. Thank you both. And thank you to everyone watching, listening, and engaging with this work. Everything we do at InsideInvestigator.org is made possible by your support. We've been so lucky, especially in the last couple weeks here, just an influx of donations and support from the public in response to our work. So thankful for every single one of you who allows us to do this work every single day. To everyone who is watching, listening, and tuning in, we'll be back in 2 weeks. And until then, be well, stay safe, and stay informed.